Hi, I'm Kelly Craig. We're staying healthy with Cleveland Clinic, Florida, and our guest today is Dr. Howard Bush. He's a cardiologist at Cleveland Clinic, Florida, and today's topic is TransRadial wrist stents. Dr. Bush, thanks for joining us.
Thanks for having me.
What is a TransRadial wrist stent?
Well, for about 30 years, we've been accessing the heart to do angiograms or x-rays, and the usual route is through the groin, through the femoral artery. Over the past few years, we've begun to enter through the wrist. The advantage of the wrist, it's got lower complication rate, it's easier for the patient, and the length of stay becomes much shorter for the patient.
I mean, sometimes you can send a patient home within hours.
Correct.
Wow, this is relatively not a routine practice here in South Florida or anywhere, really. You're kind of a specialist, aren't you?
It hasn't caught on yet. It's something that's growing. It's been done around the world for the past 10 or 15 years, but beginning to catch on in this area.
What about the efficacy?
Well, as far as the efficacy, we would never compromise the quality of the study or the outcome of the treatment based on access site. So everything we can do from the groin, as far as opening arteries, diagnosing blockages, we can do from the wrist.
And if I'm a patient, I don't know, I think I'd feel a lot more comfortable with having you do some things through my wrist as opposed to, you know, down south.
So there's two parts of the equation. One is the patient, and obviously less traumatic, easier recovery, and the other is the hospital. You know, we live in a time when everything has to be done very efficiently.
Right.
So the sooner we can get you in and out, you're happy, and the administration is happy.
Now, you actually teach other doctors this technique. How are they adapting to it?
Correct. The Cleveland Clinic is a training program. We train interns, residents, and fellows. And to bring the newest technology to the next generation of physicians, I think is part of our mission.
And how do you test to see if a patient is eligible for this procedure?
Can I borrow your hand?
Oh, please. It's been a long time.
We each have two arteries. We have a radial artery and an ulnar artery. And just by pressing down, I can do the Allen's test. And that will show that each artery is independently feeding the hand. And once we determine that, you're a candidate for the test.
Okay, we're going to hold hands after I say goodbye. For more information, log on to clevelandclinicflorida.org. There you're going to find articles and local Cleveland Clinic Florida resources that can help you. Remember to join us every Monday at 11:30 for Staying Healthy with Cleveland Clinic.
Staying Healthy on 6 in the Mix is sponsored by Cleveland Clinic Florida.